Department defends its deadline tonight for all healthcare workers to get vaccinated.
That despite some hospitals and nursing homes telling us they did have a short reprieve from the mandate. It's estimated some 7,500 nursing home workers are unvaccinated. The current mandate says all workers must have their first shot by tomorrow or be fired.
Sean Boyd joins us now on a story you'll see only here on 4. So, Sean, what does the state say about all of this now?
Well, the state's incident commander for COVID response admits the health department cannot force a private hospital or nursing home to fire someone. But those that don't terminate unvaccinated employees could face a range of sanctions, including the suspension or revocation of their license. The Colorado Healthcare Association, which represents 90% of nursing homes, and the Colorado Hospital Association say they were assured the state would not take punitive action if they weren't in compliance by the end of today. That means 100% of their employees have at least one shot or a valid waiver. Then the health department issued this statement yesterday that led to some panic. It said facilities that are not compliant with the rule are breaking the law, and employees who do not get the shot are choosing to fire themselves. Both the hospital and nursing home associations warned if they have to start firing employees, it will endanger patient safety. They're already dealing with staff shortages. But today, Scott Bookman, CDPHE's incident commander for COVID response, told me while they will be enforcing the deadline, enforcement, he says, doesn't happen overnight.
Tomorrow, the healthcare worker vaccine mandate goes into effect. This has the effect of state law, and our healthcare facility regulators will begin enforcing compliance to this law. Our goal is to work with these facilities to gain compliance over time. But the mandate goes into effect tomorrow, and we will begin collecting this information and working with facilities.
Once again, providers are confused. Some providers think they have until the end of October. Some have heard people say that no, in fact, they only have until today. And that uncertainty is leading to a lot of confusion and a lot of fear for people. And it was avoidable. It would be an enormous mistake to try and enforce the termination of 7,500 employees in long-term care if, in fact, they don't have their first vaccination as of today. That would lead to at least 4,000 residents needing to be displaced from long-term care settings, and I have no idea where they would be sent to.
The nursing home and hospital associations are also frustrated because the State Board of Health has said it may change the mandate next month to allow 90% of employees to be vaccinated or have a waiver instead of 100%. What's more, the federal government is coming out with its own vaccine mandate for healthcare workers in the next few weeks. Bottom line, the health department will take note of the facilities where 100% of people are not vaccinated or have a waiver tomorrow, and will work with those facilities to get 100% compliance. But it won't be taking punitive action tomorrow.
Yeah, give a little bit of time for everybody to sort through this, right?
Breathing room.
Yeah,
right.
for sure. It's tough.
Our healthcare facilities, I mean, those are the ones that need that most right now.
They
right?
do. All right, Sean, thank you.